here, but I don't think it's related to
Yeah,
the heart.
okay.
Any trouble breathing?
Yeah, I couldn't breathe before.
So
Yeah, they had
with this pain, you have also trouble breathing?
yes.
He means breathing in, right?
Like,
Well-
do you feel the sensation of being short of breath?
Yes,
Do you feel lightheaded or dizzy?
I just said I did.
Okay. Did they give you nitro?
Yes, and it worked.
Nitro,
And it makes your head explode too.
yeah, gives you a bad headache, makes you dizzy.
Yeah.
I think it was worth trialing to see if it helps.
Give me
Toradol
two.
helped more or nitro helped more?
Well, I'm still lightheaded now.
Yeah,
This
nitro, it opens your blood vessels up. So what that's trying to accomplish is give your heart more blood, but it also like opens up all the blood vessels in your brain.
How long is it effective for once you take a dose?
Very transient, very
Okay.
fast.
Okay.
It's fast on. That's why we like it.
Yeah,
It's
'cause
fast on.
yeah.
It's also pretty fast off. The Toradol was
I
it a
think
shot, like an
Yeah.
IV, and that's working better too. Okay.
Yeah, I still had the pain, but not as bad as it was.
Fevers or chills?
I had chills.
You
I
said
was
chills
shaking.
already, yeah. And what made it all get better? You look comfortable to me now. Would you say
I
you're?
looked comfortable the whole time since I
Would
got
you
out
say you're
of
back
Florida.
to yourself from this episode, or are you still not feeling well?
Well, no, it hurts
When
I
you
do
breathe
that.
in.
Yeah.
Yeah, but you're better now than you were before rapid
Oh, yeah,
response.
yeah.
You were like even your color wasn't that
Yeah.
great.
So you had a bad episode, maybe a bunch of medications, and now you think you're slowly getting back to your baseline.
Yeah. Well, I don't think
If the what would go
this
away.
this heaviness never fully went away.
So is it heaviness or sharpness? I know these are annoying, but it
No,
helps
no,
me
no.
determine.
I know. I'm trying to
Yeah.
distinguish the difference. It's sharp. But when I talk like this and I breathe in, I get lightheaded because I get winded. But when
Might
I
be the
breathe in, it's
nitro-
sharp.
Might be the nitro still kind of lingering. in your
Yeah, it
system.
could be. I just said that to her. I said, ooh, I'm dizzy. My eyes are like this.
Exactly. I checked your heart monitor. I checked your EKG. Actually,
Should I have any of those?
yeah.
I did
You had,
again.
like maybe at 8 o'clock, so 20 minutes ago.
Oh, yeah.
But
That
besides that,
VTech, I think it's
you
called.
had like 5 or 6 beats. Yeah.
Yeah.
So nothing worrisome, but still.
Don't you think maybe that's causing my?
It could be, but it happened at 8 o'clock, and I didn't see any for a while before that. So I don't think, and yours isn't lasting long enough, but it's something I thought about, so that's why I checked. I have your EKG here.
Yeah, it shucks. I just burped and it hurt.
Yeah. So that's what we call non-cardiac chest pain.
Right.
If your heart, the reason people have chest pain from their heart is if it's not getting enough blood.
Mhm.
So we already know you don't have blockages in your coronary
Right.
arteries, right? You had a cardiac catheterization.
And the heart MRI
When did you have the cardiac catheterization?
yesterday.
Yes, so they already know your heart gets enough blood supply. But that doesn't mean you can't be having a vasospasm in your heart or a vasospasm in your coronary arteries. But that pain is a different type of pain than what you're describing to me. It's not sharp and it's not changed by breathing, by moving.
Oh, this is definitely changing. If I lay down, forget it.
It's worse. That's what we call pleuritic chest pain. That's more of like an irritation of either the lining of your heart, the lining of your lungs, or just your esophagus.
Inflammation.
Sometimes people, what's hard is that this area, whenever you have symptoms in this area, it's scary.
Yeah.
And there could be a lot of dangerous things going on, and probably 10 times more things that are not dangerous, but obviously we don't want to miss any of the dangerous things.
Right.
So a lot of people just have GERD, esophagus
Which I
problems.
do. I take
Exactly.
protonics
And
every
a lot of
day.
people, it's hard for them to discern. It's probably the most common thing we deal with is people coming in, terrified because they're having chest pain.
That's great.
And it's either an esophagus problem or it's just regular GERD. Any of these things are possible with you. I'm reassured by the fact that we know you don't have any blockages in your coronaries. That doesn't mean you can't be experiencing little vasospasms, but your symptoms don't sound like that to me. Your
So-
symptoms sound like you're having what we call pleuritic chest pain, which is either due to an irritation somewhere in that area, but not due to your coronary arteries being
Very good.
blocked or spasming, if that makes sense.
That's good.
Been
Well,
on
the
nights for a few
MRI
nights, so sometimes I worry my words
No,
aren't
I get it.
coherent.
No,
Okay.
no. But the MRI that I took came in at that ejection rate of 26.
Yeah, your heart
So maybe
squeeze is
that's
low.
why I can't breathe. That's what I was thinking. Unless that's not what the function it does.
So usually we'll look at things. I have to look at your case a little. I just like to come to talk to the patient first before I look at your stuff too closely. I like to get a sense from you first. So your legs aren't too swollen.
They weren't swollen since day one.
Yeah, exactly. I don't think the shortness of breath is from your weak heart because we would see signs on you of extra fluid and things like that.
I came in with fluid, and they gave me that lace and stuff.
But your legs never swelled.
No, never once.
Mm.
Yeah, yeah, because my father died of cardiomyopathy, so.
How
yeah,
old
they
was
say-
he?
He got diagnosed at 60 and died at 77. So they say maybe it's could be genetic.
Familial, yeah.
Yeah,
Yeah.
yeah, but I guess I don't know.
But
how to
taking
do
good care of you during the day, you're working with a lot of experts that I regard very highly. Dr. Bokari. Did you meet Dr. Bokari? The attending, like the oldest person on the
Yes,
team.
yeah, and he told me that.
He's like the sweetest.
Yeah.
Probably the most knowledgeable person I
Yeah,
know.
he
What
told
did
me
he
that
say?
they're
You
gonna
spoke?
send me home with
Oh, the best.
medicine and the life vest.
Like,
But there's really, that's it. Like I had thought if when you go with the MRI and like if you saw something kind of like it was broken,
he's
you
an
could fix
MRI
it.
expert. He's a cardiac MRI expert. He specializes in cardiac imaging.
Okay.
So I'm not 100% familiar with your case. I'm really just here to help you through this acute issue.
Right.
But in general, he in his mind is thinking of like, so the main reason people get a weak heart space is from coronary blockages. So that's always the first thing we check.
Right.
Especially you're young, but you have family history. So we're like, let's just make sure you don't have blockages in your coronaries, and you did not. So then the cardiac MRI helps you really tease out if there's something else dangerous going on. And I don't think I don't want to tell you what it said because I'm not as familiar with the case, but I'm assuming if they're not acting on anything, and he's a cardiac MRI expert,
And he saw it, right? I mean, yeah.
I assume he's
Assume,
like,
yeah.
I assume he saw it. The read is in. He probably read it himself. Like he
Yeah.
probably put the read in.
I saw it on the app.
Yeah, it's crazy.
Yeah.
You can get like live.
Yeah. Right, tell me what it say. Left ventricle, no good.
Weak. Yeah.
Weak.
Yeah. You've probably been doing this for a while, and your body's probably used to it. That's why you're not as sick. If this had happened to you acutely, or you went from being functioning at 100% to functioning at a fraction in like a couple of days, you'd be in the ICU. There's probably been something progressive where
Building
your
up.
body.
Yeah. It was bothering me. Just it got so bad that I went to urgent care.
Exactly. That's typically what we hear is that you're kind of cruising, and then something tips you over. As
Yeah.
opposed to we see people who are in their 20s, they get some kind of virus, and then they get myocarditis, and it's
The virus.
downhill right away.
But when I breathe in, I guess if you're telling me that it's
That's
more
what it sounds like to me. I'm
whatever-
going to listen to you, and plus I have a lot of data about you already. If I was meeting you for the first time and I didn't know what your coronary arteries look like,
Right.
I didn't know what your cardiac MRI looked like, I didn't know how you've been doing the past couple of days, I'd be thinking in a different, more broad. But I already have a lot of the information I need
Okay.
regarding your heart, so I just want to listen to you, make sure you sound okay, and I think just use more of the Toradol to help with that irritation.
That's good.
I think there's something irritated or inflamed, whether it's your esophagus, maybe we can try something to calm that down too.
What is it?
Any other questions, folks?
I think you
Tom, you
just,
have any questions?
Yeah. Laurie,
I'm gonna listen to you. Let me just.
yeah, let me get out of the way.
Yeah, I'm just gonna stand.